I welcome you all to um, this special webinar to celebrate World Diabetes Day. Like I always say, preventive medicine is something that is very key, but which we don't key very much into. But it is very important, and that's why I will keep commending the organizer of this webinar in the person of Dr. Alasa Mohammed. Thanks to Dr. Ishaya for giving us a very brief but educative section on the symptoms of diabetes. He has done justice to that. So, just to refresh our memories, he said that diabetes is a group of medical conditions where the body either does not produce insulin at all or cannot properly use the insulin that is being produced. And in some cases, it is both happening. That is, the person cannot produce and cannot use the ones that have been produced properly. So basically, there are three types of diabetes. Those are the three most common ones, although there are other types that are not most time discussed. For example, the monogenic diabetes syndrome, the cystic fibrosis diabetes, or drug-induced diabetes. Those are not much common. They represent less than 4% of all diabetes cases. So we don't talk much about them because they are not most common. But there are three basic types of diabetes, which is type 1, type 2, and gestational diabetes. Talking about type 1 diabetes, also called insulin-dependent diabetes, it was formerly called juvenile diabetes, or those names now, there are school of thoughts that those names are no longer acceptable, because if you say type 1 is juvenile or early onset diabetes, you are saying that only children have it mostly. But now, people of all ages can have any type of diabetes. So we don't really use those words anymore. So in type 1 diabetes, the problem is that there is an autoimmune error, which means that the immune system of the body, which the immune system is that system that fights off infection in the body. So what happens in type 1 diabetes is that this immune system begins to fight what they call beta cells in the pancreas. Pancreas is that part, is that part of your body that produces insulin. And that the insulin's work is to regulate the amount of sugar in your blood. So these beta cells are attacked by the immune system and thereby making it difficult for that pancreas to produce insulin. So in people that have type 1 diabetes, their pancreas is not able to produce insulin at all. So they don't have insulin at all. So most times what they do is they just have to replace that insulin manually by themselves through injections most times. Now that's all about that in type 1. In type 2 diabetes, it is a totally different case. In this case, insulin is not produced enough. The people with type 2 diabetes, which is the most common type of diabetes, don't get enough insulin to regulate the amount of blood sugar. And blood sugar is needed in particular quantities. So if it is too much and there is no insulin to regulate the amount, then the body begins to react to that, and it has health implications. So in type 2 diabetes, the brief explanation is that the insulin is not produced in the right amount. That's that. Then thirdly, gestational diabetes, simply put, is diabetes that occurs in people that are pregnant. Most times, when women get pregnant, there is high level of blood sugar, especially in women that previously have pre-diabetes. Pre-diabetes is when diabetes has not been fully diagnosed, but the person has a high tendency of having diabetes. That is, the level of blood sugar is close to that of diabetes, but not exactly the amount that can make us say that the person has diabetes. So that's pre-diabetes. So this gestational diabetes, which is diabetes that occurs in women that are pregnant, occurs 50% of the time in people that are prone to diabetes due to their family history. So if your mother or your father has a history of diabetes, you will most likely have gestational diabetes when you are pregnant. That is, your blood sugar may be uncontrollably high when you are pregnant. So those are the three basic types of diabetes. Now, going to the causes, just like in most health conditions that are managed and not treated, there is no particular cause, but there are what we call risk factors. Risk factors are factors that if you add one or two of them together, that person is most likely to have that particular disease. Now, in diabetes, the cause depends on the type of diabetes that person has. Now, let me go into it. In type 1 diabetes, as I said before, it is an autoimmune disease. It means that the body immune system attacks the beta cells of the pancreas, and thereby making it impossible for that pancreas to produce insulin. So the cause of type 1 diabetes is basically the fact that that body is under attack by the immune system, thereby making it difficult for insulin to reproduce. That's the cause of type 1 diabetes. But in type 2 diabetes, there are risk factors that might predispose a person to having type 2 diabetes. Let me briefly mention few of those factors. In type 2 diabetes, the most common or most regular risk factors is body weight. People that are obese or overweight, people that have a high body mass index have high tendency of having type 2 diabetes. Now, these fats in their body is dependent on um, the how do I put it? The probability that they would have type 2 diabetes is dependent on where those fats, the fat in their body, where those fats is located. I'm trying to get a page that talks about that if I'm able to share it on my screen. Uh, wow. Okay. So share.
Please, let's up with time, sir.
Let me just go on. The in type 2 diabetes, like I mentioned before, obesity or being overweight is a very big risk factor. Now, I was trying to bring out a slide where I can show you the parts of the body where you can have fats, and it will be you will be at more risk of having diabetes than other parts. A big example is people that have large amount of fat in their abdominal area, especially men that have a waist circumference that is more than 40 inches, and for women 35 inches. They are more at risk of having type 2 diabetes than people that have lesser waist circumference. Another big risk factor is lack of physical activity, and this is related to being overweight, because people that do not involve in adequate amount of physical activity don't use up the amount of energy their body produces when they eat, especially when they eat food that are high in fat and carbohydrate. So the energy is produced, but it's not being used up. So the body converts that energy back into glucose, and it is in the blood, thereby leading to high glucose level, and that's diabetes. And another risk factor is genetics. People that are from certain races, especially African Americans, are at greater risk of having diabetes than people from other races. Then family history is also a risk factor. Like I said before, if you have someone in your immediate family, like an uncle, an aunt, father, mother, that have diabetes, they manage diabetes before, or are presently managing diabetes, you should pay more attention to your health, because you might be at risk also. Then lifestyle, which is a very important factor, the kind of food a person consumes. There is we can never overemphasize the role what we eat play in most of the diseases that we talk about most times, because the food we eat is what our body responds to. So if you take food that is high in carbohydrate and fats, and you don't use up the energy that that food produces in your body, it will be stored as sugar in your blood, and that's diabetes for you. So um as brief as it is, I hope I've been able to shed light a bit on the types of diabetes, which is type 1, type 2, gestational diabetes, and the causes of diabetes. I'll stop here so that my oga, my next the next speaker can take over from here.